Hope this is clear. Next, when I say integrated approach, that you have to follow integrated approach. Many times question comes कि sir कौन कौन से तरह के taping होते हैं? What all types of taping are there? Again, lot of confusion is there. When I ask this question in workshop also, when people are in one-to-one contact, the answer I get is कि sir kinetic taping, dynamic taping, this that. Okay, you're not wrong. You're right. But let me try to make you understand this in a more structured and streamlined manner. When you speak of taping, guys, there are basically two types of taping. How many? Two. Okay. There is non-elastic taping. There is elastic taping. Okay. When you use a tape which does not stretch, no elasticity, that is non-elastic taping. If you use a tape which stretches, that is elastic taping. Okay. Now, next you might think that इसमें क्या क्या आता है? Don't worry, I have some things with me. I will try to help you. Okay. In non-elastic taping, you have rigid taping, athletic taping, even micropore taping. All come under non-elastic, जो नहीं stretch होता. In non-elastic taping, you have rigid taping, athletic taping, even micropore taping. All come under non-elastic, जो नहीं stretch होता. This is what Jenny McConnell and her peers long back they started. Today, many people don't use it. It has some fantastic clinical uses. You should use it if you're good at it. So this is non-elastic taping. Elastic is any tape that stretches. Again, elasticon, elastoplast, dynamic taping, your kinesiotaping, K-taping, whatever you call it. Patents are there. You get the point. Whatever you call it. That also is elastic taping. But among the different variants of elastic taping, definitely one of the most clinically used and evidence-based concept is kinesiotaping. That I will give where credit is due. Okay. So let me show you a few things now. What is rigid, what is athletic, okay, because people get confused. First, this is simple. This is a micropore tape. OPD mein rehta hai, you must have seen. If you see this brown color tape, can everybody see? Is it clear? Yeah, now it's clear. See this brown color tape is a rigid tape. Yeah, it's one of the strongest tapes, rigid. This nice colors, yeah, pink. In workshops we have people fighting, sir mujhe pink chahiye, black chahiye. I'll come to that also later. This is your kinesiological tape, a full 5-meter roll. Now next, what is this? This is a athletic tape, Kramer ka athletic tape, one of the best companies of that. Now here the confusion starts. Students are confused ki sir athletic kya hai, rigid kya hai. Let me explain. Don't go by the colors. Athletic commonly comes in a white color but can come in any color. Like we have last sample हमारा blue में आया था, so it can be blue also. Rigid commonly is brown. इसमें difference क्या है? सब दोनों same ही तो हैं? No. Athletic and rigid tape both are non-elastic, but the difference is in the strength. Okay, rigid, it is much more stronger tape, so it can be used for malalignment, to push pull bones, to maintain glides, to support structures. Athletic is a much more gentler, relatively, if I may use the word, weaker tape. So this is commonly used for prophylactic taping. What is prophylactic taping? Preventive taping. I'll give in simple words. See, if a boxer goes for a match, glove पहनने से पहले हाथ पे टेप बांधते हैं ना, that tape applied on the knuckles and the wrist is to prevent an injury. Injury हुई नहीं है, to prevent. So this is preventive or prophylactic taping. wrestler जाता है to do wrestling, they apply tape on the knees. So for any sports, whichever joint might get injured, if you tape it before, it prevents the injury. This is prophylactic taping. So prophylactic or preventive taping needs a lot of tape. So for that we use a simple gentle tape like athletic tape, which is not very expensive. Okay, but when you want to treat patient कि सर इंजरी हो गई है, अभी मुझे प्रोटेक्ट करना है, सिक्योर करना है, सपोर्ट करना है, रेस्ट आई हैव टू गिव इट, आई हैव टू इमोबिलाइज इट, so healing happens, then you can use a relatively expensive and much more stronger tape like rigid tape. This is the difference, guys. Color से मत जाना कि white है तो athletic ही है, no, it can be any color. Okay, in a workshop I can also show you how to check the strength, tensile strength. Oh, so this athletic and rigid both are non-elastic tapes, both have very good uses. Athletic commonly for preventive purposes, rigid commonly for treatment purposes. You can modify, see, once you learn, once you practice, no, with your acumen you can definitely modify the clinical needs. With experience you will not, you will do your own thing, but basics we should know first. So both are non-elastic, okay, athletic and rigid. Micropore, as I told you, it is commonly used for temporary applications. It stays for 7 to 8 hours. You can apply for smaller areas कि facial pulse के लिए आप कर रहे हो, या doing for body taping, small. Big joints, shoulder, knee, micropore will tear off, paper है, फट जाएगा. So for smaller applications, smaller joints, temporary applications you can use. Okay, now again guys, let me remind you, this is an introductory session, so I am giving you outlook, yeah, trying to give you a certain perspective, an idea, breaking some myths. Clinical techniques I cannot show because it will be wrong, yeah, आपको समझेगा नहीं because webinar है, some other time in a workshop maybe, but I'm trying to give you some idea of taping in this, how to use, how not to use. So two types are elastic and non-elastic. Non-elastic means you primarily have athletic and rigid, prophylactic and treatment purposes. Okay, now elastic means you